So for my educational background, I went to high school over at Jesuit in New Orleans, and then for LSU, that's where I did my college, and I studied biology there. And then for medical school, I went to LSU Shreveport, and then after medical school, I did my preliminary medicine year in Shreveport, and then after that, I went to Pensacola to complete my physical medicine and rehabilitation residency. And now I'm back in Shreveport to be closer to friends and family. So it's called physical medicine and rehabilitation. Another word for it is also called physiatry. So the whole goal of our field is to help patients with their quality of life and their function. So a lot of the patients we might see might be a traumatic brain injury, a stroke patient, a spinal cord, but there's also many other diagnoses we'll get, and basically they'll have a significant disability that will bring them to the rehab, and our goal is to help get them to improve functionally with the ultimate goal of getting them to discharge home. Big reason I chose this especially is I always have felt like function is super important. So my mom was actually a physical therapist, and she kind of stressed to me the importance of staying active, being fit. And then about 10 years ago, I actually had an ACL injury, and during that time period, I was limited from doing sports and other things I loved. So it affected me not only physically, but also mentally at that time. And it made me realize how important it is to have your function, to have your quality of life. So it showed to me, hey, I want to do physical med and rehab because I want to help people improve their independence. I'd say I'm like a half glass full kind of guy. I really try and bring that positive energy to these patients because a lot of times they've had these significant life events, they're in a hard place, and just some positive attitude will really help the patients improve in their rehab. So my biggest philosophy is let's bring some positive energy to the patients and to the team. I'm a big team player. I grew up playing sports. I realize the value in every single person on your team. So that's one quality I'd say I bring to the table. I'd also say I'm very positive. I like everyone to kind of have positive energy around. It's contagious. When one person is positive, someone else will be positive and it will spread. And I also just feel like I'm compassionate. I truly care about people and I want them to do better. I'm passionate about always learning, making myself better. I feel like we're in the field of lifelong learning. So every year I want to continue improving, continue researching stuff, and continue to improve patient care.